In this segment, I'll talk about the electrical events of mammalian heart contraction. So let's start by practicing drawing a heart. So right atrium, right ventricle, left ventricle. By convention, we always draw it with the right atrium on the left side here. In mammalian hearts, the sinoatrial node, the SA node, has cells that slowly increase the calcium release and decrease potassium escape. Here's the cell, internal stores that have calcium, channels that allow potassium out. And if we zoom in, over time, these are closing and calcium is being allowed out. Those events make the cell more positive. They eventually start an action potential. So these are called pacemaker cells because they set the pace of the heart. An action potential starts and spreads through both atria. It doesn't pass to the ventricles. There's no electrical conduction. But it does go from cell to cell in this cardiac muscle. Cardiac muscle cells are modified skeletal muscle cells. They can have branches. They have gap junctions between cells. When an action potential gets into one, the action potential spreads through that cell, moves sodium into the next. The action potential spreads from cell to cell all the way through the atria. But there are no gap junctions connecting the atria to the ventricles. So what happens is they contract. They force these valves close, the valves back to the veins coming in, and they push blood into the ventricles. So how does the action potential get from the atria to the ventricles? There's a second group of cells. This one is the AV node, atrioventricular node, specialized for slow conduction. So slow conduction, slow action potentials. That gives time to fill the ventricles. So the atria are contracting and they're filling the ventricle, but eventually the action potential makes it past the end of the AV node, and at that point it spreads really rapidly down to the base of the heart and then back up through specialized modified muscle cells called Purkinje fibers. Those then go through the entire ventricle and cause contraction. As these contract, they force blood, oxygenated or deoxygenated blood, up into the arteries leading to the lungs or the system. So let's go through that whole system. So one is at the SA node, to have pacemaker potentials that depolarize to start an action potential. Those can be sped up or slowed down by neurotransmitter and hormones. From the SA node, get an action potential that then spreads through the atria and cause contraction. 2, the AV node allows slow passage of that action potential, time for ventricles to fill. Then 3, rapid conduction through the ventricles, starting at the tip from the Purkinje fibers, and 5, ventricular contractions. 1, 2 in the AV node, slowing. 3, fast conduction through the Purkinje fibers, and then ventricular contraction.